If you've been suffering with pelvic floor pain, you know that it's really hard to find clear answers on your questions. You may be pregnant, you may be menopausal, this may have come on suddenly, or you may have been suffering with this problem for a while. Today, we are going to answer the most common questions about pelvic floor pain, including, is it normal? What does pelvic floor pain feel like? Does this commonly happen during pregnancy? And when should I seek help for my pelvic floor pain? Okay, first, the most commonly asked question I get is, can pelvic floor pain come and go? So this is outside of pregnancy. We're going to talk about pregnancy pelvic floor pain because that's a little bit different. So we're going to answer that question next. This question is specifically in regards to pelvic floor pain outside of pregnancy. Now, the truth of the matter is women's bodies go through cycles approximately every 28 days, and our hormones change during that time. So some people find that they do have some pelvic floor pain at certain times in their cycle, and it does become a normal occurrence for them. In fact, I've had many women say, I'm just not sure if it's just cramps or if it's actually pelvic floor pain. And that's a reasonable question to be asking. So at what point during your cycle do you get the pelvic floor pain? If it's right before you're about to have your cycle, then that may be kind of normal for you in regards to you get some cramping and some pelvic floor pain. Also, some people will have some pelvic pain at different points in their cycle, but it does become kind of normal for them or cyclical. If your pain is cyclical, it could be related to another issue, including hormones or how your body's responding to your cycle. The question really is this a normal cyclical occurrence for you? If it is, you may want to talk to your OBGYN to see if there's anything that's causing that pain internally. Now, there are other people who struggle with pelvic floor pain only in certain positions or with certain activities. If that's you, that most likely is a pelvic floor dysfunction. So there's something going on specifically with the muscles or the structure of the pelvic floor that is causing those problems. If this sounds like you do want to seek help from a pelvic floor specialist who can help you figure out exactly why it is that those positions or those activities specifically cause pain. Now, what if you just occasionally notice that you have pelvic floor pain? Maybe it starts by happening once every couple of months. It's not cyclical. It doesn't seem to be related to any specific activity. And then it goes away, and it kind of seems like it just goes away on its own. Or maybe you take some over-the-counter pain medication and it seems to get better. This type of pelvic floor pain that's intermittent, doesn't seem to be tied to an activity, is not as concerning, but definitely should be watched. Because the concern would be that it would become more regular and you would start noticing it more frequently. So for people who tell me I have it every once in a while, I can't tell you what it's linked to or what position, it's not hormonally related. I've talked to my OBGYN and they say that this isn't anything to be concerned about. For them, what I ask them to do is write down when you have symptoms on a calendar. That can be a paper calendar, it can be an electronic calendar, but keep track of it so that way you can start to notice if it becomes more frequently. This can be especially helpful for people who just have it every once in a while and can't link it to something particular. If you don't have symptoms regularly, it's hard to remember exactly when the last time you did was. So if you have them every 3 to 6 months and it kind of clears up on its own, I'm not super concerned about that. But if it starts becoming more frequently, then let's work with a specialist to figure out what's going on because we don't want it to become a regular pain. So to sum up that section, because that was kind of a lot, it can be cyclical, it can be intermittent, or it can be regular. If it's cyclical and related to your cycle and it becomes kind of your normal, we're not as concerned about that as long as you know the cause of it. If it's intermittent and it's many months apart in between, not related to any particular activity, again, we want to keep an eye on that one for a while, just to make sure that it clears up on its own. If it starts to become a regular problem and it doesn't seem to be related to your cycle, that most likely is a pelvic floor dysfunction and you do need to seek help from a specialist. Now, what about my friends who are pregnant? They have probably heard that pelvic floor pain is normal during pregnancy, and there's a lot of reasons for that. Obviously, your hormones are changing. It's that time, it's that season, and they change pretty regularly. Your body is also changing as it's getting ready and prepared to deliver a baby. So there are going to be some changes in ligament laxity and how your body moves. In addition, you're growing a baby, so there's more pressure on that pelvic floor. So many women do indeed have issues during pregnancy with pelvic floor pain. This becomes concerning if it's more of a sharp shooting pain as opposed to a general achiness or discomfort. It can also be concerning if you're having a struggle with being able to walk because of your pelvic floor pain. So if you're having difficulty doing your daily activities due to the pelvic floor pain, such as walking, cleaning the house, being able to sit for work, whatever it is you need to do, then you definitely do want to seek help. Although there is a degree of pelvic floor pain that may be normal with pregnancy, especially as you advance and there's more pressure in that abdominal cavity, those ligaments are loosening up as you prepare for delivery, we still want to make sure that the pelvic floor muscles are going to be able to relax to allow that delivery to happen. So it can help to work with a specialist at this point just to prepare your pelvic floor for successful delivery. If you're hoping for a vaginal delivery, some women are planning on a C-section for a variety of reasons. And if that's you, then obviously the pelvic floor being able to relax is not as big of an issue. However, if your plan is for a vaginal delivery and your pelvic floor muscles are very tight because they're in pain, it can make it a little bit more challenging. So seeking help from a pelvic floor specialist who can help those muscles relax and teach you some techniques to use during delivery can be really helpful now to get that delivery that you're hoping for. All right, the next most common question I get is, what does pelvic floor pain feel like? And I gotta say, pelvic floor pain is different for everybody. Shocking, right? For some people, they feel a pressure and maybe even a bulging. And this can even be if you're not pregnant. Now, if you feel a bulging, especially with your hands when you're washing in the shower, this could be actually a sign of a pelvic organ prolapse. And we're going to make another video to talk more about that specifically. So if you have felt a bulging with your hands, I'm going to recommend that you go check out that video over there as soon as you finish with this one. For some people, it's an achy, almost a crampy type feeling, kind of like when you have cramps, right? But it's not in the lower abdominal area where cramps normally are. It's further down. It feels more like it's around the vagina or the rectum. And especially if you don't have those symptoms when you're having the normal cramping sensation, you definitely do want to work with a specialist to figure out the cause of that. Now, there are some people who have a sharp pain or a burning pain, and this becomes obviously more concerning, especially if it occurs with intimacy. Now we've got an issue that's affecting not just the pelvic floor, but is starting to affect the organs inside the body. This is definitely when you want to find help with a specialist who can work with not only the pelvic floor, but understands how the organs in the body work in conjunction with the pelvic floor. Because you see, if you have a lot of pressure in the abdominal cavity, which includes the diaphragm on the top, the pelvic floor on the bottom, the abdominals in the front, and the low back in the back, obviously, then it can cause problems, including that prolapse, that sharp shooting pain. It can make intimacy very painful and difficult. And obviously, that's not a road we want to walk down. In our society today, it's okay to talk about the fact that you pee when you laugh, jump, cough, something like that. But it's not okay to talk about issues when we are intimate. So if this is you, I want you to know you are not alone. I hear this story every single day. And there is help and hope for you. And the final most frequently asked question I get is, where is pelvic floor pain felt? Now, often this comes in the fact that people will come in and say, oh, I have something going on in my abdominals, or I have something going on in my gut. They feel it kind of that deep down, but they don't know that that can be associated with the pelvic floor. Because obviously the pelvic floor works in conjunction with the organs, but most people don't realize that. It's important to note that the vaginal opening, the rectal opening, the urethra, is all going through that pelvic floor. So if your pelvic floor is affected, obviously those organs can start to be affected too. So a lot of the pain may be in areas that you're not thinking, like, oh, that's my pelvic floor, including the lower abdominals, the low back, around the urethra. You may be having struggles with constipation. You may have urinary incontinence issues, and you don't realize that it's a pelvic floor issue because it seems like it's something else. It seems like it's low back pain. It seems like it's a constipation issue due to eating. It appears like it's something else. But very commonly when women make it to my clinic, they've already seen everybody else and they've done everything else. So they have already seen a urogynecologist. They have already dealt with their food allergies and changing their diet. They've already increased their water intake and all of these things, and it hasn't solved the problem yet. And that's because the root of the problem was in the pelvic floor. But the pain was showing up in different areas, so they didn't know to look there. They went to see the doctor that made the most sense to them. So if you're having a myriad of symptoms that doesn't seem to fit into one particular location, so maybe you're having some bladder issues, maybe you're having some constipation issues, maybe you're having some pain with intimacy, maybe you feel like your gut's not moving correctly, maybe you constantly feel like you have cramping sensations or you have low back pain, but you have these myriad of symptoms that just don't seem to fit together, I'm going to encourage you to look at your pelvic floor because the pelvic floor symptoms can show up in a variety of ways. All right, I hope that that's been helpful and that you've learned something new about your pelvic floor and about how those symptoms can show up and if your symptoms are normal and what you can expect. I definitely encourage you, if you're just having symptoms that are starting right now and you're very concerned about them, that's totally understandable. But if you've never had these symptoms before, I'm going to ask you to keep an eye on them for about the next week. Sometimes weird things happen with our bodies, but they'll usually clear up on their own in a week if your body's going to be able to deal with it on its own. If your symptoms last longer than a week, or they start to become more regular, or you don't feel like it's cyclical, I'm going to encourage you to seek help from a pelvic floor specialist, particularly one who's able to understand the relationship of the abdominal cavity, because we need to understand how the low back works with the abdominals. You need to understand how the organs need to be able to move and have a little breathing area in the abdominal cavity. And it's really important to understand how the diaphragm works in opposition to the pelvic floor. Because if you're not breathing correctly, your diaphragm will get tight, which will cause issues with your pelvic floor. I'm going to link the pelvic organ prolapse video here. If you have noticed a bulging when you're washing yourself, then I'm definitely going to encourage you to watch that video next to see if that sounds like you.